Hello, everyone, and welcome to a breastfeeding class presented by the Breastfeeding Clinic in the Helderberg Basin, Cape Town, South Africa. Just a quick disclaimer. The information provided in this program is to assist you in exploring all available options to empower you to make well-informed decisions to help you feel in control, be responsible for, and have confidence in your choices. Information should please not be substituted for the diagnosis and treatment of any medical condition, and also please never disregard professional medical advice or delay in seeking it because of something that you have received in this program. And this recording is not intended to replace professional or medical or other kinds of advice. Now, in this recording, we will be looking at the position of the mother during breastfeeding. And I've highlighted it for you on the list of topics that we are covering in this breastfeeding class series. Now, as you may know, there are two people involved in the breastfeeding relationship. It is a mother and a baby. And this recording, we will look at some of the positions a mother might use, and in a separate recording, we will look at baby's position. Now, although there are many positions a mother may use, the order of comfort during a feed is first we want the mother to be comfortable, then the baby, and then the latch needs to be comfortable. So often during consultation, I need to remind the mother that she is the most important person in the breastfeeding relationship. And because the mother will be spending many hours and days and weeks and months breastfeeding her baby, it is important that she positions herself so that she can hold her baby comfortably close to her breast and relax without having any strain on her muscles. So sometimes a mother will sit in an uncomfortable position on the edge of a chair with her shoulders drawn up to her ears and then latch the baby and just keep sitting like that because she's worried that the baby might not latch again. But please remember that you are the most important person in the breastfeeding relationship. So make sure that you are comfortable first before starting to help the baby latch. So, whatever position the mother and baby choose, it should be comfortable for both mother and baby, as well as effective, meaning the baby is getting the milk that they need. Now, we have talked about this before. In positioning, it influences the way a baby latches or attaches to the breast, which influences the way a baby suckles, which influences the effectiveness and comfort of milk transfer. So, how much milk the baby gets with what degree of effort. So many factors play a role in comfortable and effective feeding. So, when there are any issues, whether it is with the breast, like engorgement or mastitis, or with nipples, like pain or cracked nipples, or even with the mother's milk supply, or the baby's weight gain, or the baby's behavior, the very first thing that you need to do is look at the baby's position and baby's latch. Because more often than not, that is the cause of the problem. So we will look at troubleshooting in a later recording. In this recording, we will just be focusing on a few basic positions. Okay, so as mentioned, when breastfeeding a baby, there are many positions a mother may use, like sitting on the floor or the ground, or sitting on a chair, or lying down, or lying back, or standing up, or walking around. So if the mother is sitting or lying down, she should be comfortable and relaxed with her back supported. And notice any tension in the shoulders and then relax them. Feet needs to be supported if sitting so that the legs are not hanging loose or uncomfortable. Now, some mothers appreciate a footstool when sitting in a chair, and this actually tilts the pelvis back and prevents you from the um, feeling the need to lean forward. Um, Having your feet on a little footstool also elevates the baby, so you're also not compelled to lean down or lean over the baby. A mother can try to keep her knees a little higher than her hips, or keep her knees roughly level with her hips so that her back muscles won't have to work too hard. And if she sits in a chair that is too low, forcing her knees far higher than her hips. That could put a lot of strain on her spine. Also, sitting with knees much lower than the hips can also place too much stress on the back over time. Okay, so let's have a few look at a few positions where the mother is sitting. So the cradle position is where the baby lies across the mother's body, held completely facing the mother, typically at a slight angle, with the baby's head and shoulders a little higher than the hips. The baby is well supported by the mother's arm across the baby's back, tucking the baby's hips into flexion and kind of molding or wrapping the baby's body around the mother's waist. So, this position should place the baby's nose at the level of the nipple and the baby's lower lip and chin well below the nipple. So, baby's head lies on the mother's forearm, not the crook of her arm, or it could lie in the hand on the side from which baby is feeding, and the baby's lower arm is tucked around the mother's side, not trapped between the baby's chest and the mother. And the baby's head, as mentioned, should not be in the crook of her arm because that would take the baby too far out to the side. And then the baby has to bend their head forward and they cannot get their chin and tongue underneath the nipple. So the baby in the yellow circle seems to have his head in the crook of his mother's arm, and it also seems like his head is tilted to the front, having his chin on his chest. Now, can you stick your tongue out if you've got your chin on your chest? We'll look at this just in a little later today. Um, Now, we think the tongue fills the newborn's whole mouth. So, in order for the breast to go in, the tongue must come out. Yeah, and having the baby's head tilted a little back will drop the jaw so the tongue can come out and the breast can go in for a deeper latch and a more effective feeding as well. Now, the cross cradle position is the same as the cradle hold, but the baby is held with the mother's opposite arm, and the neck and the shoulders of the baby are supported with the mother's hand, and her fingers rests behind the baby's ears. There is no pressure on the back of the baby's head. Any pressure on the back of the baby's head will cause the baby's head to drop forward, so he will drop his chin to his chest. And then again, if your chin is on your chest, it's harder to open the mouth wide. So anyway, the mother's forearm in the cross cradle hold supports the baby's back, and this gives the mother more control over positioning the baby's head, and it might be easier to learn at first. So this position is frequently used as a learning position for full-term babies or to position a small or premature baby who tends to curl up or roll up when they're placed in the cradle hold. We also call this the mother-led technique, which helps the baby put his natural feeding processes into action. So the breast can be supported if needed by the same side hand without having to insert it between the mother or between the baby and the breast. And also the nipple areola area is more visible to the mother in this position. Now, some mothers would start the feeding in this cross cradle hold, and once the baby is positioned and latched and suckling effectively, then they'll change to the cradle hold. Just take care that the baby's head is not held too tightly, preventing movement. And forcing the baby's head onto the breast may disrupt placement of the baby's tongue and encouraging the baby to lift his tongue rather than cup and move it forward and down and outward for latching. Okay, so the underarm or clutch or side sitting or football or rugby hold, whatever you want to call it, this is often useful for twins, and it also gives the mother a good view of the attachment. And this position is comfortable after a cesarean birth because the baby's weight is away from the incision, and the baby sits facing the mother with his legs kind of under the mother's arm, and the mother supports the baby's body on her arm and supports the baby's head with her hand at the back of the baby's neck. It's sometimes useful to feed babies in a more upright position, for example, if they have a cleft, depending on the type of cleft. And sleepy babies may stay awake a little better in this upright position. Now, low birth weight and sick babies need a lot more support for their heads than larger babies. However, be very careful to support only the baby's head and not to put pressure on the back of it, causing the baby to bend his neck forward and forcing his chin down to his chest, and then preventing the mouth from opening wide. Another sitting position is what we call the koala hold or the straddle position. So the baby sits up facing the mother with their legs on either side of the mother's leg, kind of straddled over the mother's leg. And this position is sometimes helpful with, again, with baby with a cleft, depending on the type of cleft. And it also improves alertness in a sleepy baby and for babies with repeated ear infections or babies who are cutting their upper teeth might be useful to have them feeding in this position because it tilts their head back so there's less pressure on the upper gums. Okay, so let's have a look at a few positions where the mother is lying down. Now, this laid back position, or reclined, or baby led, or natural breastfeeding, or biological nurturing position, whatever you want to call it, the mothers are usually lying back rather than sitting up. The baby is placed on the mother's chest and then allowed to use their reflexes and their natural behaviors to find either breast and self attach. So, this isn't really a position, it's more a baby driven approach to breastfeeding. And in this baby driven approach, many problems like nipple pain and milk supply issues can be avoided. Now, the suggestion is to favor this position for the first 4 to 6 weeks. Now, this position, or rather approach, helps activate the baby's feeding reflexes and it allows the mother's body and shoulders to relax and her lap to open up. Now, the mother's slope can range from 15 to 65 degrees. Now, why this body slope of 15 to 65 degrees? Well, for safety, the mother can see her baby. Efficacy, it's actually baby's little GPS is better activated when baby is tummy down like this. And then for comfort as well. If a mother had a vaginal birth and she's has a tender perineum, in this position, there's no pressure on her perineum. Um, and for any mother, there's no muscle strain in this position. Just need to have a lot of pillows to support your arms on either side as well. So mothers can be comfortably leaning back in a bed or a couch or a recliner with her back supported and pillows to support her head and her shoulders and arms so that all her muscles can relax. And the baby will be on her chest with gravity keeping the baby in position. And one tip is to have both baby's hips touching the mother's body. Um, and to have baby's head a little higher than the bottom. So the breast is round, the baby can come from any position, any side of the breast. Just have the bottom a little higher than, have the baby's head a little higher than the bottom. And we also want to ensure full frontal contact. So not just the chest, but having the baby's legs as well in this little froggy position. And the mother's arm supporting the baby's head. Um, but as I mentioned, the baby is kind of more in charge of the latch, more a baby-led latching. Um, and when the baby is in charge of the latch, the baby can latch deeper with a wide open mouth and a relaxed jaw and a tongue that's brought forward. So the latch is a little deeper. Now, this is a basic checklist for the baby-led approach, some questions to ask. So if the baby is upset, do we need to calm the baby down? Is the mother fully supported? She's completely relaxed, partly reclined, not upright or completely flat. When a mother lifts her hands, does the baby stay in place? Is the baby tummy down with the froggy legs, the inside of baby's legs touching the mother? And is the baby's head a little higher than their bottom? And has the mother tried varying the direction of the baby's body? So the baby doesn't need to be in one specific position. The breast is round. So if we view the breast as a clock, the baby can latch from any side, 3 o'clock, 6 o'clock, 9 o'clock, 12 o'clock, so long as the baby's head is a little higher than the bum. Also, check if the baby's feet is touching the mother or something else. Babies often need that support on their feet. And then also if needed, has the mother tried to shape her breast? like a hamburger, not a taco, meaning shaping the breast parallel to baby's lips to help the baby latch deeper. So Google natural breastfeeding to watch a great video by Nancy Morbacher and Dr. Teresa Nesbitt on their site naturalbreastfeeding.com. It's a 30-minute video that you can watch for women with 4 different breast sizes, and they show us how they do laid back breastfeeding on a bed and on a couch and on a chair, etc. When we compare the mother-led and baby-led approaches to positioning and latches, um, mother-led where the baby is held in the cross cradle hold, and baby-led where the mother is in a more laid-back position. Looking at the comparison, you can actually see that the baby-driven approach just makes everything easier. Okay, so let's look at the side lying position. So this slide shows mothers breastfeeding while lying down on their side. Side lying can be useful when a mother is tired, she wants to sleep. She can breastfeed without getting up if the mother has pain after birth or a cesarean birth. Lying down on her side may help her to breastfeed more comfortably, depending on the length of her abdomen, because if she's quite short, the baby might kick on her incision. Anyway, a pillow under the mother's head and a pillow or the back of her couch along her back can help to support her. And a pillow between the mother's thighs can help her to relax more fully. And the baby's head, again, see the baby in the right slide, look kind of looking down. We want the baby to be looking up. Um, that mother has a lower arm under her head for support, or like the mother in the picture on the left has her arm wrapped around her baby. So the upper arm can be used to guide the baby to the breast, or to support the breast, or to hold the baby in place. Though pillows or a rolled blanket can also help support the baby's back. Just again, take care that the baby's nose is at the level of the mother's nipple, and that the baby doesn't need to bend their neck forward to reach the breast. They still need to look up at the breast. Now, these images illustrate safer bed sharing or co-sleeping arrangements. Now, most parents will find that they might sometimes bring their baby into bed, and this is particularly common for breastfeeding mothers. So it's important for parents to be familiar with safe bed sharing practices. Bed sharing is associated with an increased chance of SIDS or accidents if a parent has taken drugs or alcohol, or is a smoker, or if the baby is premature. And the Academy of Breastfeeding Medicine protocols have a breastfeeding and bed sharing protocol. That's protocol number 6. And you can download these protocols for free at www.bfmed.org/protocols. Thank you so much for watching this recording. In the next recording, we will look at positions of the baby during breastfeeding. And please visit the Breastfeeding Clinic at www.breastfeedingsa.co.za if you would like to book a private consultation and receive the class notes. And you can also navigate the class recordings easier from the website. And please feel free to subscribe to this channel for more breastfeeding class recordings. Take care till next time.